Welcome to the platform. Today we want to talk about a different topic that is called hypertension. We want to understand what hypertension is. We understand what is hypertension. Hypertension is high blood pressure and several types of high blood pressure that we have. So if you are watching a new person in the channel, come on, like the channel and also subscribe and like the channel. Right. So welcome everyone who is watching. We are talking of a different topic today. That someone requested. Several people requested we review the topic. So here you are watching and you are in the channel and you feel like you want to support. Subscribe, welcome, and tell us where you are from. Tell us where you're from when you're coming. Just chat to the channel and say where you're coming, and let's go connect to everyone. This is Benjamin the Wise Guy bringing you this topic that is called hypertension. And we want to understand. We were doing epilepsy last 2 weeks and we have just finished epilepsy. So my guys who are here watching, subscribe to the channel. If you are new, subscribe to the channel. You'll be getting notifications when I'm online or when we are online with several people. So my friends, I can see Nogat Plus. Nogat is telling me 96,000 euros donated. Nogat, you have jokes. We have Krishan PR 590. Welcome to the platform. Let me get to know you. Nogat, which country are you from? And Krishan, which country are you from? I hope you have. Did it go through? Or what went through? What went through, Nogat? What went through? Okay, let's continue, my guys. If you are watching, you are a new person to the platform. It's good you subscribe to the channel. And we do what we have just started. Beatrice said hi, like nice one. We're just starting another topic. Today we are doing hypertension. Today we will be doing hypertension. So welcome everyone. Nogat Plus, Krishna, I don't know which country you're coming from. If you are new to the platform, you subscribe. Clean Jaden says this. Clean Jaden, welcome. I hope you have subscribed. Clean, which country are you coming from? Why are you not telling me which country you're coming from? Nogat, Krishan, Clean, which country are you coming from? Today we want to talk about hypertension, high blood pressure. So let's connect towards each other. Kenya. Clean Jaden comes from Kenya. Welcome. I also come from Kenya. Clean Jaden. We want to talk about hypertension, high blood pressure, and we will manage it. So today we will start and we will go step by step. Hypertension, everyone knows that it is blood pressures that are high. If you ask anyone what is hypertension, this person will tell you it is high blood pressures that are high. Hypertension is a condition where the force of blood pushing against the wall of the arteries. The heart pumps pressure. The force of when the heart is pumping pressure, it's force against the arteries and the veins. This makes the heart work harder and can damage the blood vessels and organs. You see, a simple understanding of, if you're not getting it, just ask. If you're not getting it, just ask about it and we will. I'm still telling people, welcome to the platform. Today we are talking about hypertension. If you have not subscribed, please make a step and subscribe. Your notifications will be there, and like the platform, like the channel where you are. You can like the channel, and you get. So I'm bringing hypertension. I want to talk about hypertension in depth, starting from today, because it is a very long topic. So where you are, subscribe and tell me where you are from at the charts. Go to the charts and tell me where you are coming from. Which side of the country are you coming from? Which side of the world are you from? So you can ask any question through the platform. So let's understand what is hypertension first. Let's understand what is hypertension. Is a condition whereby the force of blood pushing against blood vessels. And which blood vessels do we know? We know arteries, we know veins, we know capillaries, all those, we know about all those. And it stays high over time. This makes the heart work harder, can damage the blood vessels and organs. It can damage the blood vessels and organs. When the heart is pumping, if you have a pump that is too powerful, even if you're pumping water, some pipes can crack. So the pump of your body is the heart, and the pipes that pass blood are the veins and the arteries. So the force that is exerted onto those arteries is what we take it as blood pressure. But we have how we do it. What is blood pressure? Blood pressure is written into two dimensions, systolic and diastolic. So when the heart is contracting, when pressure of the heart when it is contracting, pressure when the heart contracts, it's called systolic. So when you are pushing and the heart is contracting to push blood, it's called systolic. Reach through, welcome, hi, Reach through. I see you're here, Reach through. Today we are talking about high blood pressure. We want to understand what high blood pressure is. So when the heart is contracting, pushing blood towards the body, it is called systolic blood pressure. But diastolic blood pressure is when the heart relaxes. When it is contracting, it is pushing blood. Take an example of this is the heart. So when it is contracting, it is pushing blood. So when it is pushing blood, that is, and then you take blood pressure of the arteries and the vessels, that is called systolic blood pressure. But when it is relaxing, because it has to come back and relax before it gains the tension and push again. So when it is relaxing, it is called diastolic pressure. I think you have understood. I go slow so that people can understand these things. So understanding hypertension. Welcome everyone. I see people are coming and going, and you have not subscribed. Subscribe to this channel and ask any question that is medical, or add something that if you get to know. You know more about this thing, I know less, you add something, So blood pressure, first thing we have said is the force that the arteries get and the veins when the veins themselves are passing blood. That is hypertension. And it is measured against something. You cannot say something is high, it is not related to something. Forgiveness is underrated. Hello, Dr. Ben. How are you doing? Forgiveness is calling me. Hello, Dr. BMW Ben. Forgiveness, you want to buy me a BMW. So, let's understand high blood pressure slowly. Yeah? The force exerted against your veins and arteries when the blood is moving in your body is the pressure. But you cannot say it is high if it is not measured against something. It has to be measured against something, So here we are talking about hypertension, and there is systolic and diastolic, because the heart pumps. It's a continuous process. The heart pumps like this as the blood moves, So as the heart pumps the blood, when it is contracting to pump the blood, that is diastolic. But when it moves back to relax before it pumps again, that is diastolic, when it is relaxing. Systolic is when it is contracting. So where are my papers again? So this is it. I want you to check this out. I have written 120/8. This is systolic, and diastolic. Rich is still saying hi. Welcome. Forgiveness is underrated. Look at this. Write it like this. See it like this. So I'm saying this. 120/8. Systolic, diastolic. Systolic, diastolic. So when the heart is contracting, it is called systolic. When the heart contracts and then we take the measurements of BP, we get the pressure at the valves and arteries, it is called systolic. But when it is relaxing, it is called diastolic. That is doctor, check blood pressure for my grandmother, and top number is high and the lower one is 55. Forgiveness is underrated. That one is called isolated hypertension. We will talk about it. It is a type of hypertension that disturbs older generation. So for now, we are just introducing this topic, hypertension. We understand. Now, we have talked about this thing, systolic and diastolic, and you have understood when the heart is contracting, it is called systolic. When it is relaxing, it is called diastolic. So that's why it is written like this, 120/80. This one is a normal blood pressure. Now, let's talk about pressures, because we have said we cannot say something is high if it is not relating to something. It has to relate to something. It has to relate to something. So normal is what I've written here. This is normal blood pressure for everyone of any age. If you have this is a normal blood pressure. And I've said, I'm moving slow. I have said that the pumping of pressure and the valves, and you take the pressure because the curves come in your arms. So when you are pumping blood and you are listening using a stethoscope, or you are taking by the machine, what it does, it cuffs your muscles, and then we take the pressure reading, how the heart is pumping. So the pressure inside the valve is taken by the you put. So if we listen or you use the automatic one and it sees that it is 120, when the heart is contracting, it means it is normal. Or 80 diastolic, it means it is normal. Now, what is elevated? Which one is high? Normal person, a person who is not above 65 years. A person who is not above 65 years. Elevated is, if we say 120 over 1, 120 and no, not 120. Let's talk about 120 over 130 over 85. 130 over 85. When you start having a pressure of 130 over 85, what is happening? Your blood pressures have started going up. But the diastolic one, when you have 85, we say it is normal, but a bit elevated. This pressure is a bit elevated. 130 over 85. 120 over 80 is normal. 130 over 80 or 130 over 85, it is normal, but it's a bit elevated. So hypertension stage 1, where you go to a hospital and then you are told, now you have hypertension and this one should be stage 1. It is 130 over 139 going to 140, and then over 80 to 89. So look at this. 130 over 80, it's a bit elevated. But 130 over 89, let me put it this way so that people can look at it well. Where is that card? This is 130 over 89. 130 over 89, that is elevated. When you get to J Hank is here. Greetings, J Hank. Welcome to the platform. I know today is a holiday and people are celebrating somewhere So, hi, welcome. So, when you get to 140 over 90, 180 over 120, that is elevated hypertension. 140 over 90, that is high. It is high. 130 over 80, that your BP has started going up. 180 over 120, that is a crisis. Now, let's go and say that we have several types of hypertension. What are several types of hypertension? We have several types of hypertension. Primary, which is also called essential hypertension. This is the most common type of hypertension that we have. The essential hypertension, which is primary hypertension. It is the common type of hypertension that we have. Develops slowly over years as you grow. No single identifiable cause. You just start having hypertension. The primary one, essential. No single it is linked to genetics and family history. And sometimes high salt intake. Because when you take salt, salt retains fluid, and it retains fluid in the blood vessels. So when you retain fluid in the blood vessels, the heart will have a lot of problems when it is pumping blood. You get? So primary essential hypertension is the first. Welcome, my guys. If you are watching me for the first time, come to the chat and tell me I'm watching you from this country, I'm watching you from here. So high salt intake, this is over years. Genetic family history. Obesity is another problem. Stress is another problem. Smoking is another problem. And smoking brings something that is called endocarditis. Alcohol. Sorry about that. Sorry about that. So alcohol is another thing. There are several. I will explain how this hypertension crisis comes. Sorry about that. So alcohol is another thing. Lack of exercise is another thing, and aging too is a very complicated thing when it comes to hypertension. And we have seen that here, forgiveness in the narrator that say, Doctor, I checked blood pressure for my grandmother, and top number is high and the lower is like 155 and 155. That is called isolated hypertension. It is called isolated. Lynette Chando, welcome Lynette. We're talking about hypertension. So let's continue to talk about these problems. Sorry, please. When we are talking about isolated hypertension, this one comes when a person is aging. When a person is aging, and you see, when a person is aging, there are several things that happen to a person that comes in and makes you have some problems that come out. So aging is one thing, genetics and family history is one thing, high salt intake is one thing, and stress also is another thing. Smoking also, endocarditis, and several things like nitric oxide that constrict the blood vessels. So that one is the first type of hypertension, primary, which is essential hypertension. And then we have secondary hypertension. High blood pressure caused by another medical condition. High blood pressure that is caused by another medical condition like kidney disease, hormonal disorders, thyroid disease, sleep apnea. Certain medications can cause you to have these problems. Pregnancy can make you to have this problem. Adrenal gland disorders, that are in the kidneys can make you to have this condition. So kidney disease, hormonal disorder, thyroid disease, sleep apnea, certain medication, pregnancy, adrenal gland disorders, all of them can cause you to have this problem. So as you listen, if you don't understand anything, I'm going slowly because I want everyone to understand that is watching. And if it is you are watching for the first time, welcome to the channel. If the chat is open, what you can do is you can chat there and say, I'm watching you from Kenya, I'm watching you from US, I'm watching you from this country. If you are not understanding something, just ask and I will explain. And then we have, greetings, Life with the Russells. Welcome to the chat, Life with the Russells. We have something that is called resistant hypertension. Blood pressure remains high despite using several medications. Poor medication adherence, kidney disease, excess salt intake, obesity, and secondary causes. These ones are resistant despite you give medication, despite you are trying everything. It is poor adherence to some medications of hypertension that we give. You see, so this is resistant. It's the fourth one, resistant hypertension. Now let's talk about malignant hypertension. Malignant hypertension. We have several types of hypertension. I'm just going through them. Malignant hypertension, a severe and dangerous rise in blood pressure that can cause organs damage quickly. It is called malignant hypertension. Here you get several headaches, blood vision, chest pain, confusion, shortness of breath, seizures. This one is a medical emergency. The fifth one. You see, we have several types of hypertension. Several types of hypertension. Severe malignant hypertension, essential hypertension. We have talked about it. The first one, primary. And then secondary hypertension. You see, secondary. Isolated hypertension, the one that forgiveness is underrated, was saying. Isolated hypertension, whereby the one that is above is way more higher than the diastolic one. The systolic one is more higher than the diastolic one. All these are types of hypertension. Resistant hypertension, isolated hypertension, malignant hypertension, white coat hypertension, high readings, normal readings at home. Blood pressure rises mainly in medical setting due to anxiety. But when you go home, your readings are okay. Your readings are okay. See? At home you are okay. When you are in hospital, there is a problem. This one is called white coat hypertension. And then we have masked hypertension. Masked hypertension. What is masked hypertension? Opposite of white coat hypertension. Normal in clinic, at home it is high. You feel good when you are in a medical facility, but when you are home, it is high. Still dangerous because it can go higher and go unnoticed. We have gestational hypertension. Gestational is that one that attacks the coffee cakes. Welcome coffee cakes. Today we are talking about hypertension. And we have named several types of hypertension here. We have named several types of hypertension. So gestational is the one that people get when they have what? They are pregnant. When they have pregnancy, it can progress to something that is called, coffee cakes, that one, pregnancy. It can progress to something that is called preeclampsia or eclampsia. Requires close monitoring, even if you are in hospital. These are the types of hypertension. Let me go through them again before we go to causes. The types of hypertension we have the first one, which is primary hypertension. The second one, which is secondary hypertension. Primary hypertension 1, the second one is secondary hypertension. And then we have other types. The other types of hypertensions are isolated hypertension, resistant hypertension, and then we have malignant hypertension and white coat hypertension and masked hypertension. And then the last one we have said on other type is gestational hypertension, the one that coffee cakes are said when people are pregnant. So there is some categories of hypertension, but every type of hypertension is brought by the same things that we are going to discuss. This is just, I'm starting the topic today. So I should tell people why hypertension comes. Now, the normal hypertension, the normal blood pressure should be 120/80. Normal blood pressure. It is not even, it's not just stated that if you have 120, why would pain bring your blood pressure high? Because of release of prostaglandins. Release of prostaglandins are inflammatory mediators. So they constrict your blood vessels, and when your blood vessels constrict, the pressures go high. I'm just introducing, and I will explain all these things slowly by slowly. You see. So I know you have not fully understood that process, but I'll explain it. Coffee cakes. Pain releases mediators of inflammation like prostaglandins. And then when the prostaglandins are released, your blood vessels release something called nitric oxide. Nitric oxide constricts the blood vessels. When the blood vessels constrict, your blood pressure goes high. I will go through them very slowly. Today I'm not talking so fast. Now, those ones are the types of hypertensions that we have. And then, who are at risk of hypertension, or what are the causes? Before I start explaining how, because all the blood pressures that go high, our bodies are same, and they produce the same hormones, they produce the same mediators of immunity. And Barry walking exercise, thanks a lot coming in. Doctor in the house, thanks. Done cutting the lawn, my lawn today. Oh, it's okay, Barry walking exercise. Thanks for tuning in. Miriam is here. Miriam, welcome to the house. Miriam, welcome to the house. So, you see, who are at risk of getting hypertension? We have said high salt diet, obesity, smoking, alcohol use, stress, diabetes, kidney disease, family history, and physical inactivity. Old age is also a factor. I will not go to these symptoms because I want to explain something that is important. Now, we have gone through types of hypertension, and I've said if you have any question like the coffee cakes, bring that question up because there is something important I want to explain. I have said, our bodies, they produce the same hormones, they are created with the same blood vessels, and they work the same way. So you start worrying, why do this one have hypertension and the other one do not have hypertension? Why do our family members always have hypertension and the other does not have hypertension? That is where we want to dig deep and start reasoning. Why do I have to take medication for hypertension and the other person do not take medication for hypertension? Marjay, welcome. Greetings, Dr. Ben and everyone. Marjay, welcome. So, I have introduced hypertension. Let me go through them before I start going slowly into important points that people need to understand. Medicine, NSAID, Brufen, what does it do to prostaglandins? They stop prostaglandins. NSAID, they stop prostaglandins from working, and that is sometimes a bad thing. They stop prostaglandins from working. So we are coffee cakes and ask a question. Medicine, NSAID, Brufen, what does it do to? They stop. Prostaglandin is a mediator of inflammation. So when they are released, where they do where you are injured, more blood to come, and they release some enzymes, or they release the mediators of pain. So if that place blood comes there and more prostaglandins come there, you feel pain. But if prostaglandins don't come where you are injured, the pain does not come because the nerves are not given the mediators. The nerves around and the swelling will not be there. That's why sometimes you are giving this medication to stop, but sometimes you don't give, because if you stop prostaglandin on some injuries, what will happen? You will have a problem like the wound healing will be slow. So let's continue. I want to repeat about the type of hypertension, the types of hypertension, but right about now, let me repeat this. What is hypertension? Hypertension is a condition whereby the force of blood pushing against the walls of the arteries and veins and capillaries rise over time. The force, because whatever we measure, high blood pressure is the force on the veins and the arteries. So when the heart is contracting, is what is the one that is high, this one, the above one, which is called systolic blood pressure. But when it is relaxing, it is called diastolic blood pressure. Systolic and diastolic blood pressure. You see? So what is blood pressure? It is written in two numbers. You check the force of blood when the heart is contracting, which is systolic, you write. And then you check the force of blood in the veins when the heart is relaxed, you write it down, which is diastolic. So you see, the one that is diastolic is very important. Why? Because when the heart is relaxing and the force is down, when is the best time to take your BP readings? It depends with the type of hypertension, but regularly every time, because if you wake up, if you sleep, it has no specific time coefficient, because blood pressure is not always at the same, written as the same. See, so let's continue, my guys. Let's continue. So anytime you can take. I was on blood pressure readings. I'm still continuing. I'm revising the what is blood pressure. Now we are talking about types of hypertension. We have said there is primary and secondary. Primary is essential, linked to genetics, high salt intake, obesity, stress, smoking, alcohol, lack of exercise, and aging. But secondary, it is linked to a disease, and these diseases, maybe you have another disease and it brings the, kidney disease, hormonal disorders, thyroid disease, sleep apnea, certain medications, pregnancy, adrenal gland disorders. You understand? These are secondary hypertension, and characteristics is often appears suddenly in secondary, may be more worse and severe. So there is something I want us to talk about hypertension, because I will not go to the others, that one we will discuss later. There is something I want to introduce which is very important when it comes to hypertension. When it's diastolic, the danger is high because you might fall. Yes, diastolic, I was about to say that forgiveness is underrated. The diastolic one means when you are resting, and let's say your pressure is, when the heart is resting, and let's say the pressure is around 80. So it means when it will pump, it will go above by some 20 or 25, then it comes and rests a bit again. But let's say that you have a diastolic, the one that is down when the heart is resting, of 90. It means that when the heart will pump, the pressures will go high, like 40. That will mean like it will go up to 100 and something, way above normal. So we check on the one that is diastolic, the one that is down, this one, so much, because let's say if it is 120, you minus 120 plus minus 80, what do you get? That is 40. You add 40 plus this one, 20. So it means when the heart will pump, it will go to 160. and it can rupture your blood vessels. So the difference between the isolation and the other one can give you see. So these readings are important. So when the diastolic, the one that is down, is 80, it's okay, because when your heart will pump, 80 is resting. So when it is pumping, maybe it will go up to 110 and then 120, then it rests again. But imagine when your heart is at rest and it is pumping it is resting at 100, the diastolic one, the one that is down. It means when the heart is pumped, it will hit more high numbers and you will have problems. Evelyn Lakatosa. How are you doing? I'm fine. We are discussing hypertension. Which country are you coming from? Which country are you from, Evelyn? So you see, these readings are like that. And when we are getting to hypertension, there is something important we need to understand. Why do we have the same bodies? Why will that be like tachycardia? No, tachycardia now is the heart, abnormal rhythm of the heart. Blood pressure is different. Tachycardia, we talked about it and we said it's when the heart is having high beating rate. The electrical signal is high, so the heart is beating at the tachycardia. The signaling and pressure is different. Although you can have tachycardia, the heart beating so fast and the pressures are normal, or you can have tachycardia and the blood pressures are high. So that is the rate of the heart beating. That is the rate of the heart. What would look like someone with BP? What would you look on with someone with BP or symptoms? Coffee cakes. You want me to say the symptoms? Like what symptoms will you look at someone with high blood pressure? I think that is what you are asking. Symptoms with someone with blood pressure. Someone will have headaches, dizziness, blood vision. We will talk about it. There is a coffee cakes. I want you to understand this. The heart and blood pressure, they are connected. But tachycardia is a term meaning the heart rate is high, the beating, the signaling is high. So you can have tachycardia and your BP is high, or you can have tachycardia and your BP is low. We will talk about that and we will relate with it. So don't worry, we are going to be there. Tachycardia is just a term used to say your heart electrical, the sinoatrial node and the others. When we were talking about tachycardia, you saw how I was explaining how the electrical system comes, and the Kent, the people that are born with the Kent node. So there is a tachycardia. Finding Donna, welcome. It means the heart is beating so fast. And sometimes you can find the heart is beating so fast and the BPs are high, or the heart is beating so fast and the BPs are low. So I have understood you and go through it. There is something I want us to go through which is important. And this is understanding the real hypertension. Understanding the real issue in hypertension. There is something called the things that makes pressure in your blood to be normal. It is called angiotensinogen renin system. Let me write it here. How your pressures are balanced and how your pressures are monitored by your body. So renin angiotensinogen aldosterone system is a hormone. These are hormones that help your body to balance themselves. And you've seen there, we have said sodium intake is important. So in blood pressure, blood volume, and fluid and electrolyte balance. Let me repeat it again. Today I'm going slow because people need to understand blood pressure, blood volume, and fluid and electrolyte balance. Blood volume and pressure, they go hand in hand. If you lose a lot of blood, the pressure will go down. You see, because you don't have enough volume of blood in the vessels. And you know, it is mainly activated when we have a person has a normal blood pressure, which I've said is 120/8. Which I'm saying it is 120/8. So if a person has a normal blood volume of 120/8, let's see what happens to the body of a person so that you start having high blood pressure. What happens? Because hormones are involved, and these hormones are called, it's called renin. I like writing things down. Let me get this here so I can write with this. Renin. The first hormone is called renin, because you cannot just be having high blood pressure. Renin, angiotensin. Let me take another paper. Have the hormones that regulate your blood pressures. One is called renin. The other one is called angiotensin. The other one is called, I'm writing them down, I'll show you, aldosterone. Renin, angiotensin, aldosterone. Look at these hormones. Renin, angiotensin, aldosterone. Very important. Renin, angiotensin, aldosterone. So we have another hormones that help you. These ones are in your blood vessels. They are called nitric oxide. Nitric oxide. We have another one. This one. Nitric oxide and endothelin. Now, let's talk about renin. This one is produced by your kidney. Renin is produced by your kidney, and it is a very important hormone when it comes to balancing your blood pressure. Angiotensin is a hormone that is activated by renin. And then we have aldosterone. Aldosterone is another hormone that is called, it loves salt. But there is something else that is very important, that is called, very important, and this thing is called antidiuretic hormone. Antidiuretic hormone. You see, antidiuretic. Renin, angiotensin, aldosterone, and antidiuretic hormone. So, what do renin do? Renin is a hormone that when your blood pressure goes down, maybe you have not taken water, the kidney senses that your blood pressure is down. So that is why not taking the pills can be messy. Yes. If you don't take BP pills, you can ruin your kidney. And this is how I'm going very slowly. So this renin, this one, when you have not taken your pill, as they say, the kidney suffers and it produces renin. Renin activates something called angiotensin. They receive this one called angiotensinogen from the liver. You see, the liver produces something called angiotensinogen from the liver. It is not inactive, it is just in your blood. So when renin is released, the kidney releases renin when it senses low blood pressure, you have dehydration, low sodium, and reduced blood flow to the kidney. When the kidney senses that there is low blood pressure, the kidney senses that dehydration is there, you have not taken fluids, or you are diarrheaing so much, or there is a problem. What happens? It releases renin. And what do renin do? There is something called angiotensinogen that the liver produces, and it is in the blood, just flowing in the blood. Renin converts angiotensinogen 1, the hormone that is from the liver, to angiotensin 1. You know, the kidney has sensed there is a problem, or suffering. There is low blood pressure, dehydration, or maybe you don't have enough salt in your. So it does what? It releases these mediators. So when it releases them, what happens is conversion to angiotensin 2. The blood passes through the lungs and the blood vessels, because now whatever that the liver has released is being converted to 1. So the blood passes through the lungs and blood vessels, and the enzyme called angiotensin converting enzyme converts it to 2, from 1 to 2. You see, and that one is the deal. Angiotensinogen is from the kidney, is activated by renin from the kidney. You know, it sensed that there is a problem, and it released renin. So in the blood, as the blood is flowing, it is converted to angiotensinogen 2 by an enzyme called angiotensin converting enzyme. So the second one is the one which, this one is the one which constricts the blood vessels. When the blood vessel notices now there is angiotensin 2. It constricts the blood vessels. And when it constricts the blood vessels, let me write this one. Let me see. Let me draw this here. If you are pumping blood, sir, good afternoon. Good afternoon, sir, If you are pumping blood, and these are the two, if you are pumping blood in this vessel here, the pressure will be low inside the vessels. But if you are pumping blood in this vessel, the pressure will be too high in this vessel. So you, in your kidney, the kidney sensed that there is low blood pressure, there is no enough sodium, you see, and it released renin, and angiotensin 2 converted, and it constricts. Your blood vessels were like this, now they are like this. So your blood pressure goes high. If you want to understand blood pressure, it's a very simple mechanism that the larger the blood vessel, your blood vessels have the capacity to contract and expand. So when your blood pressures are high, it means they are contracted, they are small. I don't feel like writing. Okay, listen. Ayesha skin. Listen. If you don't feel like writing, when your blood pressures are high, it means they are small. When your blood pressures are low, it means they have expanded. You see, the two funny things. Your heart pushing blood in this vessel, it means the pressures here are high. Your heart pushing blood in this, it means it is using less energy. So the pressures here are low. So today I've introduced some hormones in your system that are very important. Renin, kidney, angiotensinogen from angiotensin. This one is from the liver, aldosterone, and antidiuretic hormone. Aldosterone is a hormone that regulates salt. And what is the work of aldosterone? Why does it regulate salt? Because of this. Look at this. If you have low blood volume in your vessels, low blood volumes in your vessels, it means you need something inside the blood vessel to bring water inside, so you have more volume. You have seen people that have feet that are swollen. So what can help to bring water inside the blood volume, inside the vessel? Aldosterone brings sodium inside. Sodium. And salt takes water inside. So if you take sodium inside, salt, salt likes water, salts like water. So if you take sodium inside, water that is outside the blood vessels will come into the blood vessel. That is what this hormone called aldosterone does. There is something else called antidiuretic hormone. Antidiuretic hormone. What does antidiuretic hormone do? Diuresis is losing water. Diuresis is losing water. When I'm talking about diuresis, those drugs that are called antidiuretics means when you take them, you start losing some water. So, antidiuretic hormone, when it is released, what does it do? It closes the channels of your blood vessels. You know your blood vessels have holes that are regulated like this. We call them gated. We call them gated channels. We call them gated channels. So this is your blood vessel. This one is your blood vessel. So these channels can close and open, and that is the work of antidiuretic hormone. And the system, the hormonal system that comes is called renin, and it is called angiotensin aldosterone system. That is the system that controls your blood pressure, and it comes from your brain, your kidney, and your heart. And that is how we find we know how to give blood pressure tablets and blood. You see, so that is how can a person reduce the blood pressure medications once a week instead of. It depends finding donor with your problem, because you see we have the types of hypertension. So when you go to a doctor, your doctor will find out what is the problem with you. Why are you having high blood pressure? Do you have secondary or do you have primary? Welcome Betty, welcome. Do you have secondary or do you have primary? And then the doctor will check, do you have another problem that is coming in? Which drug do you use? Which drug would you use so that it can balance? And if we treat this problem, will this person stop taking this medication? You see, that is how doctors follow up. And you have seen there is another way, that is the hormones that I've said. These are the hormones: renin produced by the kidney, angiotensin from the liver, aldosterone from the brain, antidiuretic hormone from the brain. That is one system. That is one system that is called renin angiotensin aldosterone system, and I'll explain it tomorrow. I'll explain it tomorrow so well. Now, there is another one. Something that is called nitric oxide. And anyone who has a question, let me answer questions as we continue, because I can see 30 minutes to go. Anyone who has a question can ask. I want, as we continue on hypertension, we understand, because some people would have problems in understanding these hormones. And why do we give enalapril because of atenolol? Why do we give nifedipine, calcium channel blockers, instead of beta blockers? We have another system, that in the other process whereby your blood pressure is balanced, and this process is by production of nitric oxide. Just a minute. So Coffee Cakes is asking, so what does the BP meds do? Stop the release of hormones that rise BP? Of course, now we have started learning. I like it when people understand. Coffee Cakes. Now you see, when we go slowly, you start understanding what BP medications do. That is definitely what they do. My mom have BP. She is on Resilo 50. That's a calcium channel blocker. I want people to understand like that. You know, when people are understanding, you feel good. Now, that is one part, the Coffee Cakes. Losartan 50. Yeah, the Resilo 50 is Losartan 50. Losartan 50. Losartan 50. Now, Majay B, Losartan 50. Let me see. Losartan 50 works in the kidney, and angiotensin receptor block. It works at stops this angiotensin. It blocks it from being converted to angiotensin 2, which is a vasoconstrictor. And you see, the Coffee Cakes have started having heads. You know, because we are talking of hormones, it must be these drugs are stopping these hormones from, you see. So your mom is taking something that is called angiotensin receptor blocker. It when angiotensin 2 is blocked, you have blood pressure falls and blood vessels relax. Kidney damage may slow. So Majay, that is your mom. That is what your mom takes. Now let's go to another one. Let's go to the other. Now we have talked about the kidney. That is, how do they know what block to get to? We will come there, but we will know by taking some, by doing some blood test on your kidney and doing some other blood tests. We will come to that, to those tests. Now, let's talk about nitric oxide. Nitric oxide gas produced by the endothelium. Oh, you are on Iberstan. Iberstan is Iberstan. The only problem is these drugs, when you are reading them, you are reading the company name, not the component. So I have to check which component it contains. Let me check Iberstan. Iberstan is the same as losartan. Yes. So Resilo 50 and Iberstan same are in the same group. So what they do, they block angiotensin 2 receptor so that it cannot constrict the blood vessels. So it means if that is working on you, the problem is coming from the kidney. But we will reach there. We are just starting, guys. Let's go slowly by slowly. You know, when you go slowly by slowly, you understand things well. You understand things so well. So we have another one, which is called nitric oxide and endothelins. Nitric oxide is a gas. Boss, welcome to the platform. Thanks for tuning in. Nitric oxide is a gas produced by the endothelium inner lining of blood vessels. It is produced by the endothelium, the inner lining of the blood vessels. It is important in controlling blood vessel tone and blood flow. Blood vessel tone and blood flow. You see, this one, it stimulates some things like acetylcholine, bradykinin, shear stress from blood flow, exercise, and histamines. What nitric oxide do, how it does. Welcome, Boss One. Welcome. Thanks for tuning in. What it does. What does it do? It widens. So when your pressures are so high, your blood vessels are like this. It widens the vessels. And when it widens the vessels, your blood pressures go down. Simple Kate, welcome, greetings, hope you are good. Guys, don't forget to share and like, don't forget to share and like. And if you are new in this platform, subscribe. We have talked about the other system, the kidney system and the liver system. This is another system. Thanks, boss. Thanks for liking. This is another system. A very complicated system a bit, but your body has sensed that your blood pressures are high. The next thing it will do, by some stimulants, you see, produced on the walls of it will produce that gas that is called nitric oxide, and it will dilate. Instead of your blood vessels being like this, they will be bigger. And by being bigger, what will happen? Your blood vessel pressure goes down. Because if it holds, it means some small vessels will rupture. This is another system about your body, how it balances your blood. Nitric oxide. We have endothelin. Endothelin cells produce pre-endothelins, which converted to big endothelins. These ones are also produced on the cells of your blood vessels, the walls themselves, the walls of your blood vessels, these ones. So, when your body senses that the pressures are going so low and the kidney is not getting enough blood, what happens? What happens is this. It releases endothelins and it works on your blood, the vessels, the blood vessels and veins and arteries. And what happens is, instead of them being bigger, it vasoconstricts. It makes their gases. It makes them. So the opposite of nitric oxide is endothelins. The opposite of nitric oxide is endothelins. As these ones relaxes your blood vessels to be big when pressures are high, this one constricts your blood vessels to be small when pressures are low. You see that? Let's continue, my guys. We have 3 ways in which your body regulates high blood pressure and low blood pressure. The first one we have talked about is renin, angiotensin, aldosterone, and antidiuretic hormone. I'm fine, Nene. Last time, Nene, you saw me holding a syringe with doing a procedure, and then you ran away. Nene fears syringes. Nene fears syringes. Nene, don't run away. Today I don't have syringes. Today I don't have syringes. So this is it. This is one, from the kidney to the liver, how your bloods are. If you are coming in right now, hope you watch to understand. And this one is on the blood vessel itself. And we have the third one. The third one is called beta cells. Peter, welcome. Peter, remind me which country you told me you're coming from. Please. I keep on forgetting. I think I have a lot. We have beta. Oh, I understand. Yes, I understand. Norway. Okay, Peter, there is a coming from Norway. Maybe she'll be here. She's from Kenya. She's in Norway. Maybe she'll be here. We have something that are called beta cells. Beta cells. Now, these ones work on your. Heart. The heart muscles have got beta cells. So there are two, beta and alpha. They work on how the heart functions, how it beats, and wait a minute. They work on how the heart regulates. If you have low blood pressure, sometimes you will feel your heart pumping so fast. The alpha and beta cells. You see? And when you feel that your heart is beating so slow, it means the beta cells are affected. The beta cells are affected. So beta cells, they work by doing something that is called vasodilation. Alpha cells, they work by mild vasodilation. So I've introduced this topic, and I was explaining all this because I will explain what renin-angiotensinogen and the regulatory mode of this. So today's topic, now it's your, if you have not understood, please ask any question. If I go more than that, people will be confused. Now, we have talked about high blood pressure. I want to repeat as an ending. I have like 20 minutes to go. Hypertension is a condition where the force of blood pushing against the walls, the force of blood pushing against the walls of the arteries stay too high over time. This makes the heart to work harder and can damage the blood vessels. We have said that when the heart is pumping, contracting to push blood away from the heart, it is systolic. When the heart is relaxing, it is called diastolic. Because you have to pump, push blood, come back and relax again, push blood again. So when it is relaxing, it's called diastolic, and it is written as systolic when it is pumping, diastolic when it is relaxing. And we have categorized blood pressure into two main categories: primary hypertension and secondary hypertension. Between those, there are several types of hypertension, like the old age hypertension, isolated hypertension. We have resistant hypertension, we have malignant hypertension, and white coat hypertension, masked hypertension, gestational hypertension. All those are types of hypertension. I have introduced the regulatory hormones of hypertension. So the next thing we will do is, I will explain how this system regulates renin-angiotensinogen system, the nitric oxide and endothelin system, and beta cell and alpha cell system. And that's why I've introduced this slowly. And you see, when I introduced, like, the coffee cakes have started knowing that, oh, isolated, resistant, gestational, and isolated, resistant. Oh, let me go through them again. We have isolated, resistant, gestational, masked. If you are writing, you can write down masked hypertension, white coat hypertension, white coat. Blood pressure rises mainly in medical settings due to anxiety. That is called white coat. You know that when you go to a hospital, you see a doctor, blood pressure goes high. Masked hypertension, opposite of white coat. When you are in the hospital, you are okay, but when you go home, it comes back. And then the one that ladies get when they are pregnant, gestational hypertension. Those ones are the other types of hypertension, but the main ones are primary hypertension and secondary hypertension, which comes with genetics. Primary comes with genetics, high salt intake, obesity, stress, smoking, alcohol, lack of exercise, and aging. Secondary comes with kidney diseases, hormonal diseases, thyroid diseases, sleep apnea, certain medication, pregnancy, and adrenal gland disorders. You see, those are the main types of hypertension. Then we get the others. But I have said the introduction of these hormones, renin, angiotensin, aldosterone, antidiuretic hormone, nitric oxide, endothelins, and beta cells and alpha cells. I've introduced them because all of us, we were born the same. We produce the same hormones. Are they curable? Curing hypertension. Some can. If it is brought by another disease, it can. Secondary hypertension can. But primary, sometimes it has a problem, and we are just introducing. So follow from today, start following. I think I need to replay this stream. Yes, please. Simple Kate, when we finish, please start from the beginning. You will understand. So these ones are the hormones. This is called renin, angiotensin, aldosterone, which controls side of blood vessels. I will explain that system. And then we have another system that is called nitric oxide and the endothelins. Also controls the blood pressure, and beta cells and alpha cells that control three types of system: renin, angiotensin, nitric oxide and endothelin system on your blood vessels, and beta cells and alpha cells on your heart. The main three things that control your blood pressure. Very important. So what I'm left with, if you have come in and you are interested, please start this from the beginning. You will learn a lot. So that question that Simple Kate has asked, are they curable? That one is a long topic, but you can only answer that if you go step by step with me and understand. So secondary hypertension is brought by another disease, but primary hypertension is many things involved. So what I want to know, anyone with a question? Yes, Onik, welcome. I can see you are here today, Onik. Yeah. What I want people to understand right now is your pressure, your blood pressure is always balanced by your vessels, your veins and arteries and capillaries, the kidney and the liver and the heart itself. So if you have any disease that is attacking the heart, you can have a blood pressure. If you have any disease, and not only blood pressure, we are talking even of low blood pressure. We are talking even of low blood pressure. So if you have any disease that is attacking the kidney, you can have high blood pressure, because you saw renin is produced from the kidney, and an injured kidney will always produce renin. Not forgetting that the kidney itself, it produces something, that a hormone, erythropoietin, that produces red blood cells. You see that? So it's of importance to take. Hypertension is not just a walk in the park. Imagine that is an introduction. I've not even explained these systems. So I will go slowly on this topic, and that's when you will know that we have several drugs of hypertension, and someone cannot be given this one or that one. You see? So that is it for today. That is it for today. Anyone with any question? Let's talk with anyone with any question. I will be doing a video on renin angiotensinogen system, and it will be of importance. It will be of importance, so that people can understand when we are talking of what causes this, why, like Maje in the house has said, is using losartan. Why is Maje's mother or grandmother not using atenolol? Why? You see, those are things that we need to keep in mind. Those are things that we need to keep in mind. You go to a doctor gives you something that is called nifedipine, calcium channel blockers, and like atenolol, and then what happens next is your blood pressure goes down, then after some time it comes back high. Why? You see, those are things that we need to take control of. So anyone with any question can ask before I log off. Tomorrow we will be dealing with renin angiotensinogen system, and we continue on hypertension and the drugs. If you are watching, if you are new to the channel, you know what to do. If you are new to the channel, you know what to do. If you are new to the channel, subscribe to the channel. And on top, subscribe to the channel. Anyone with any question, the topic of today will end there, and unless anyone else has anything to say, let me see. I'm giving 1 minute for anyone who has a question, so that I can answer. If you are here and you have any question, if you are here and you have any question, it's open, you can ask. Anyone with any question that you can ask about the topics we have to learn about hypertension. I will rewatch the stream. It's powerful and thanks for the wisdom. Thanks a lot. Welcome. So today we have introduced blood pressure, and for tomorrow we'll deal with something else. I think my time is up, and everyone who is here, thanks a lot for everything. Till tomorrow, blessings, blessings, blessings.